Welcome to the Dental School Guide podcast, your ultimate destination for all things dentistry. I'm Dr. Tanner Townsend, your guide through the complex world of dental education. Join us as we uncover the secrets of acing dental school admissions, navigating residency programs, and exploring career opportunities. Please share and enjoy. Real quick, just wanted to make all you pre-dental students out there aware of a resource. If you've ever been worried about getting into dental school or are wanting to get into that school of your dreams, then you definitely want to check out a program called Dental School Guide. In the program, we walk you through how to save money, time, and heartache when applying to dental school. There's so much fluff out there when it comes to resources for getting into school, and we are streamlining all of that. With our comprehensive digital course, expert mentorship, and personalized application review services, you'll have everything you need to stand out to admission committees. Take advantage of this amazing resource that will help you increase your chances of getting into dental school. You'll want to check out dentalschoolguide.com. Check it out. Welcome back to the Dental School Guide podcast. I'm your host, Dr. Tanner Townsend, and today we have UAB Dentistry with us, and we have the Director of Recruitment, Wendy Scripps, with us on the podcast today. Wendy, welcome to the podcast.
Much. I'm super excited to be here today to be able to tell everyone about how awesome University of Alabama at Birmingham School of Dentistry is.
Well, we are super excited to hear more about UAB and kind of get to know the scoop and the inside scoop on what you guys have going on down there. So first and foremost, tell us a little bit about yourself, Wendy. What's your background and how did you end up at UAB?
Oh, goodness. So in this position, I am Director of Student Recruitment and Engagement. So I get to go out and meet all the pre-dental students, but then I also get to work with current students. So like I'm over our student ambassadors. I work really closely with our student organizations. And believe it or not, we have like 20 student organizations specific to dental students. So that's a lot of organizations. And I get to work with all of them to do some fun stuff. I came to UAB to do my undergraduate work back in the 1900s. I did both my graduate. I have two graduate degrees. My most recent one is in higher education administration. I think like a lot of people in higher ed, I just kind of fell into it. Just one day I was not doing higher ed and the next day that I was. So I have been working specifically with UAB for over 15 years. So in student recruitment, admissions, undergraduate, graduate admissions, that kind of thing for a long time. So I definitely bleed green and gold. I've been here forever. I have no intentions of ever leaving UAB. So that's just a little bit about me. I enjoy working with my pre-dental students. It's always fun. It is always heartbreaking, though, to see them graduate and go off into the big wide world, but it's a good time while they're here.
That is wonderful. Well, I'm excited to interview you, Wendy, because you see the admissions side and the recruitment side. And I kind of want to take this time a little bit to hear a little bit about the recruitment side, because we don't often hear about that and kind of what that looks like from your perspective as well. Before we jump into stuff more specific about the school, tell us a little bit about what you do in terms of recruitment and how you go and visit schools and kind of your target area for where you go to do that recruitment.
Okay, absolutely. So I will do student recruitment pretty much anywhere. I think that's one of the best things that happened during COVID was it gave us the opportunity to do virtual meetings with students. So even if it's a school that is maybe really far away or too far for me to travel to, I can still do a virtual meeting. And I'm open to that. So I tell students anytime you let me know what works for you, because I also provide after hours appointments for students. Obviously, we're in Birmingham, Alabama. It's Central Time Zone and does not always work for everyone. So I'm able to offer a lot of different times. I travel consistently around the Southeast. So, anywhere, all our border states of Tennessee, Mississippi, Florida, Georgia. I go as far as North Carolina, South Carolina. We'll go on to Louisiana. Pretty much anywhere if a student would like for me to come, or a student group, pre-dental societies, pre-dental clubs, whatever the case may be, I always try to make it there in person and use Zoom as kind of that last last ditch effort. This is the only option that we have. So I also attend a lot of the larger conferences. So like HOSA International is the big one that I attend. I do attend our state HOSA meeting as well. I go to the American Dental Education Association meetings, and where we have the Go Dental recruitment fairs. We actually have a virtual Go Dental recruitment fair coming up in a couple of months. So that's a good way to meet lots of dental schools. So all of that information is on ADIA's website. It's virtual, it's free for students, and it's just a really good way to connect with a lot of people. So I get to, travel a good bit and go out and do a lot of things working with advisors as well as the pre-dental students. And then from the admissions side, I'm the first point of contact. That's bottom line. With pre-dental students, I'm your first point of contact. So I am lucky that I get to offer individual appointments for students. I can do that over the phone. I can do it in person. I can do that on Zoom, however we need to make that work. Again, I also offer those after hours appointments because a lot of students are in school or they have to work. From the admissions perspective, I work through our admissions process through ADSAS. I work with students specifically to make sure that they're the most competitive applicants. I mean, that's my goal, is to help students realize their potential, become the most competitive applicant, and work with them to know that not everybody's, path is A to B. Some students kind of have some ups and downs and twists and turns. Everybody doesn't go straight from undergrad into dental school. So I like to help students work through that. From the admissions, I'm part of the admissions committee here at UAB, which is I think we have like 20 or so people on our admissions committee who work with processing applications, supplemental applications, and then doing our interviews as well. So unfortunately, they don't let me interview. For some reason, they don't think that I could be like objective. Like, you want them all. And I'm like, I do. I want all the students.
I don't think there's anything wrong with that. I think
Sure.
it's they should throw you on that committee or let you interview. What the heck?
I can do everything but interview.
That is awesome. Well, in terms of the school itself, I'm sure, like, in terms of your recruitment, you're very seasoned in speaking about the school and the unique aspects. What are some things that make UAB unique compared to other dental schools?
So I think all dental schools have some measure of uniqueness. And I always encourage students to look at all their options, because it's so competitive. I mean, dental school is extremely competitive. I think some of the things that make UAB unique is our location. I mean, we are located in the heart of downtown Birmingham, Alabama. We are surrounded, by, let's say, it's over 100 city blocks that includes our undergraduate, our graduate programs, as well as we have a school of medicine, we have a school of optometry. Our students get to work really closely. There's a lot of interdisciplinary, work that our students do. So you're all learning from each other, because even though this is dentistry and it's oral health care, it's still health care. Our students have the opportunity to work with a lot of populations as well because of where we're located. We are right beside our Veterans Hospital, so that's a specialty population our students get to do rotations through, as well as we have a special needs clinic that is for adolescents, younger adults and children with special needs. So they get to experience that aspect of working with that population. Hospital dentistry. UAB has a level 1 trauma center for our hospital. So some of our students get to work with some really cool cases from that perspective. And so I think our location is one big part of it. We offer dual degrees in business administration, also DMD PhD programs for those students who are really interested in research. We also have some programs with some of our community, members, in terms of our students who really want to get out and work in the community. We have a lot of programs set up so students can do that. Also, because here's a big one, I love this one, because we're located in a rural area, even though we're an urban campus, Alabama's very rural. We have a rural dental program in which students can complete a year with one of our partner universities. We currently partner with the University of Alabama in Tuscaloosa. They do a year there to get a master's degree in community health, and then they come in and do the 4 years of dentistry with us. And so it's a way to help students kind of figure it out. Like, how do I get back in? If I want to work in a rural area, how do I do that? What are the special needs of that population and those kind of things? So I think we have a lot of opportunity that you may not have in some locations. I think that's probably the biggest thing that makes us unique. And I mean, and our mascot's it's a dragon. So
That's pretty cool. Dragons are
right,
pretty neat. Now
right.
that master's program is pretty unique. So I've got a
Mhm.
question with you on that one. With that master's program about rural health, how is it a year program? What are kind of some of the basis that is it like kind of you take a certain number of students from that program every cycle that's admitted? How does that typically work in that relationship with Alabama?
So that program is set up that students apply through ADSAS, just like they were applying to dental school. And we have an indicator on there where students can select, yes, I'm interested in the Rural Dental Scholars Program. If they do select yes, then we go through and process out those applications to determine the best fit for that program. We then make referrals to the program and say, hey, these are the students we want to refer. They get interviewed through Alabama and make a determination on, I mean, most are always, going to be acceptable. If we found them acceptable, they are as well. And then those students do that 1 year master's program and roll into the next cycle with School of Dentistry. So they're School of Dentistry students for all intents and purposes. I mean, they participate in things with us. They have their own things, obviously, at University of Alabama that they do. They come over to the dental school and, they have all the access to our own campus things. They participate in our welcome day, our orientations, being very actively involved with us. We stay in touch with them. We do a newsletter, that kind of thing. But that 1 year program is really specific because it is unique. And I love that because it gives them those opportunities to get out into these very rural communities where there are a lot of people who don't have access to healthcare, particularly oral healthcare. Alabama has a big shortage in dentists. So people who are interested in staying in the state of Alabama and working in a rural area, there's a lot of incentives for that. So we're, working again really closely with that program to prepare those students to work in it.
How many seats are available every year for those students that want to
It
pursue that?
varies. It varies. We currently do not have a set number. We kind of work it off interest. We started
Mhm.
this program 2 years ago. So we have current D1s who completed that program, and then we have an incoming class of D1s that just had huge welcome day last Friday, and we have students in that program. So we have ranged between about 5 and 8 students so far. And our dental school total seats is 84. So ultimately, the students who are in that program, as long as they successfully complete that rural health, community health master's degree program, I mean, they don't have to reapply or anything. They just slide right into that 84. So we're essentially, making sure that they have a seat available. And so we've kind of had it, like I said, 5 to 8 students. Will we increase it? Possibly if we see more interest.
Well, that's a really cool program. I have not heard of that one before, so that's
A
pretty
good
neat.
one.
What are some other things in terms of clinical experience that you feel that UAB does an excellent job at offering its students?
Mhm. So a couple things. One is that because of some of the shortages of, dentists and dental locations across the state of Alabama, we've actually opened up 2 sites in rural areas. So one is in Decatur, Alabama, which is in like the Wiregrass region, so like southeast. Yes, southeast. In Decatur, and we have opened up a dental clinic there. our students get to go down. I mean, we cover all their expenses and room and board and all of that. But they get to go down and do they get to do rotations there. So they'll go down and spend a week working with that population and learning from the dentists who are at that clinic, which I think is really cool. And we're also in the process, it hasn't opened yet, but they have like got the space. It's being renovated. It's going to be amazing. And it's in Decatur, Alabama. So that is going to be northwest. So we're trying to cover all our ground. So I think that's one big thing that students have the opportunity to get involved in clinically. But also, I mean, we're a one-stop shop. So we're not just a dental school, but we're a practicing dental facility. So we have got our comprehensive care clinic. We have got our, urgent care clinics. So for like emergency dental care, we offer for students. We have faculty practices. Well, our students, they work in those. We have a faculty practice. We have like 8 specialty CODA accredited specialties. So everything from orthodontics to perio to endo. If students are interested in, pediatrics, I mean, we have all of those clinics here in our school. So our students are able to rotate through those. But then we also have clinical experiences in our community. So we work really closely with a couple of different groups, the Foundry, Love Lady Center. These are going to be different nonprofits in our community. Cahaba Valley Healthcare is a huge, huge nonprofit that we work with that provide no cost or low cost medical dental care to individuals. So our students do a lot of clinical rotations out there, and we even have a lot of students who will work there afterwards. So, it's a really good clinical environment to get a variety of experiences. I want to say last year we had over 64,000 patient visits.
Wow.
Some of those obviously are returning patients because, you see a dentist every 6 months. But I think 10,000 of those, or nearly 10,000 of those, were new patients. So our students don't have to bring their own patients unless they just want to. We have all of that available for them. So I think those are some of the unique things that our students get in from a clinical perspective.
That's wonderful. And this is one of the questions that I feel like I always get asked by pre-dental students when I speak with them is, well,
Mhm.
how early do I get clinical experience at the school? And that seems to be just one of those age-old questions that always seems to pop up. Um,
Yes.
and so from UAB's perspective, when do you guys start trying to get students into clinic and getting their hands either on a mannequin, but especially a patient?
Mhm. During their first year, I mean, we're getting moving. I think a big part of our learning is, I mean, obviously those first 2 years, there's going to be a whole lot of that. You've got to learn how to be a dentist first. So we're going
Yeah.
to be teaching it. You're going to get to do some observations and see how it's being done, and then you're going to get to start doing it yourself. So our students start off really early. Within the first couple of weeks, they're going in and doing their own dental impressions of themselves and their friends. And then they're also going to be doing things like working specifically with, like they'll be assigned a bay, and in each one of those bays, there's usually 3 or 4 students as well as faculty members in there. So they get to do a lot of the observations and assisting as they learn it very early on. And that just kind of grows with them through their D1 and D2 year. And then as D3s, they're assigned their own patients. And obviously, that follows them through until graduation. But it's a lot earlier than people think. I think in general, all dental schools try to get students into clinics very quickly because, I mean, that's how you learn. You got to see it being done. Some of our students who are coming in have worked as dental assistants, so they have some more experience than other students. But our students, particularly our 3s and 4s, they are very engaging with our D1s and 2, and they're always like, assist me, come here, let me teach you this, that kind of thing. Watch how I do it. Obviously, while, faculty is teaching as well, and faculty is there for supervision purposes, but I think sometimes it's easier to learn that way, like in a small group of 3 or 4 people, all feeding off of each other and talking to each other about, hey, this is how we do this. This is what this is. This is how you take care of your patients. So very early on, first year, we start getting them into the clinics in some way.
That's great. Now, some students have concerns about, okay, well, if I go to school here, there's a giant network of alumni that help me either find a job when I graduate or help me know what I need to do to apply to a specialty or have suggestions on what to do next in their career. What kind of support, if any, does UAB provide for students post-graduation, whether they're doing a residency program or going into the workforce?
Oh, absolutely. So, yes, we do have a large alumni. We are the #1 dental school in the state of Alabama. We're also the only dental school in the state of
The
Alabama.
number one. The number one.
The number one. But along with that comes a lot of alumni who are very supportive of our students. And we engage our students with our alumni multiple times throughout the year through actual events that we host, like our alumni weekend and things like that. But also through, alumni will just come in and do talks with the students, or if they are hiring, they want to come out and get to know the students better to see who's interested in working in their practices or even selling their practices to them. But so there's a lot of engagement from that perspective. Our alumni, they're pretty amazing. Like, I love them, which, they are just very much, they know what students had to do for 4 years. So now they're like, all right, let's go reap the benefits of all of what you have learned. So that's a big help for students. We also have, through our alumni society, just a general networking. Students can get a peer mentor. So that's another thing that they can work through while they're going through dental schools. They'll have a peer mentor, they'll have a faculty mentor, and then we also have an alumni mentorship. So it's a lot of that networking for sure. And then I think from the other perspective is that, a lot of students come into dental school saying, oh, I want to be a pediatric dentist, until they do a pediatric residency or rotation, or they never thought about doing a rotation, and then they go through one of ours and are super excited. But we work really closely because we have those residency programs here. And our students are very interested in general, getting involved very quickly. So we do know, hey, after a couple of rotations, whether or not they're really interested in those individual residencies. And I think that it helps them out because, let's say you are interested in pediatric dentistry. Well, you're going to do a rotation in pediatrics and you're going to get to know people, and they know people who know people. So there's a lot of that connection. So we work really closely with our students in helping them determine if that's what they want to do, and then help them in being successful in doing so.
I love that. Well, kind of switching gears here, let's switch to more the admissions side
Okay.
and peel back the curtain just a little bit of, I feel like so many students and pre-dental students are like, oh my gosh, I have no idea what the heck happens on that admission side. What goes on from that side? But tell us first, walk us through the ideal avatar pre-dental student that's applying to UAB. What does that student look like to you, and who's the person you guys are targeting that you want as part of your school?
We really want someone who is clear that dentistry is what they want to do, and that they have been working towards that goal. We're not looking for a perfect student. We're not looking for a 4.0. We're looking for solid academics, solid DAT scores. I mean, we're looking for students who have, we don't have a minimum, but competitive students bring in about 150 plus shadowing hours. We consistently want that in general dentistry because that's what you do first. You become a general dentist first. However, I tell students, if you have the opportunity to do, some shadowing with individual, residency programs or individual specialty programs, do it. I mean, you should definitely take advantage of that just so you see a different perspective. And we want students to have some diversity in their shadowing. So not just a private practice, but go out into like some of the community practices, or go out into some of the different, larger corporate practices. Like, get a big feel for what dentistry is all about. We're also looking for students who are actively involved, whether that's in their campus community, their, home community, their civic community. What are the things that you've done? What are the things that are important about you? Or, things that make you who you are. And we're also going to be looking for students who have some volunteer experiences. I mean, if we know anything about dentists, is that they're very philanthropic. So they're always active, always involved. So we're looking for students to have at least 100 plus volunteer experiences. And that doesn't have to all be in medical or dental related types of things. It can definitely be in, like if you work in a food kitchen, we have a great one here called Blazer Kitchen, and a lot of our students still volunteer there. If if you love animals and you go out every Saturday and walk the puppies to help get them socialized, then absolutely put that on your application, because all that's about who you are. It makes, helps us to see who you are on paper. So obviously we have minimums, like, students have to have a 3.0 to apply. Or I think that that's where you can start being competitive, is at that 3.0. We have some academic course prerequisites. All of our stuff is very similar. ADSAS does a great job of breaking that down for students through their program guides. So I always encourage students to go there. And then I think that, overall, the student that we're looking for is well-rounded, interested in dentistry, meet, our requirements to be able to, go into dentistry. That's kind of the big picture. So you want numbers? You want?
Sure. I mean, if you're willing to share them, yeah. I mean, I think that sometimes students get held up on the numbers, and it's like you said, it's not necessarily we want a well-rounded candidate. We try to look holistically, but sometimes
Yeah.
people are like, well, what if I got like a 16 on the reading section of the DAT? I know the scoring's changed, but
Right.
like, the what if I got this, or what if I don't have this one class yet, or I have, so
Mhm.
little things. If you've got little things like that, we'd love to share that
Yeah.
with the listeners.
And definitely, I think students do get caught up in that. And I always remind them, I was like, everybody looks differently. And we do, really, very much so. It is very holistic. There are some things, though, that are non negotiables. Like you have to
Yeah.
have those prerequisites. Now, you can apply, and those prerequisites are in progress or will be taken before you get into dental school. But there's those, you have to take the DAT. I can't process your application without the DAT.
Yeah.
So there's a lot of things that, I call checklists. I mean, you got to have certain classes, you got to have, a certain GPA, you got to have, some really solid DAT scores, those kind of things. The non-academic things that to me are just not checklists, that's going to be things like your, community service, volunteering, extracurricular activities, whatever your campus community involvement is, as well as like your, your shadowing and things like that. Those, you shouldn't put a number on those. Those should just be things that you're doing. Now, a lot of schools have a minimum, so you need to look at all those schools and find those minimums and be hitting those for the shadowing hours and volunteer hours. I always tell students, for us particularly at UAB, a 3.5 or higher GPA moves you in a very competitive range. That's not to say that we don't take students who have a 3.4 or a 3.3 or 3.2, but all of our students are not 4.0s. And so I always tell students, make good grades. You have, this is dental school, that we have to see that you can pass the coursework,
Mhm.
And then when you're talking about things with the DAT, which, I mean, who likes a standardized test?
Yeah.
No one here is fond of those standardized tests. But what I will say is that, they have shown, you know, that if students
Predicted
score,
success. Yeah.
they do. They truly do. They truly do. With the new scoring, which is also giving me a headache, like I just want to, like, why are we? I just memorized all the numbers. Going from 2 number to 3 number. There are some conversion charts and stuff that students can look for, so I always tell them to go there and check that out. Because we're still looking for you to stay within, good solid applicants have 18 to 21s in their individual sections. I do find it interesting that you said that about reading at a 16, because we'll have students with like 21, 24 in the sciences and the maths, and then reading is like 12. What happened? You had to read everything else. So, I don't think one bad score in a section is going to knock you out completely. I mean, we're looking obviously for good scores because it shows, hey, do you know the material? Are you going to be able to do this when you get into dental school? I mean, because I think, I hate the expression everybody uses, but may as well use it. But it's like the hose pipe coming at you. All the water is just being poured all over you all at one time, like just constant, constant, constant. And that's true. And so we need to see your GPA. We need to see your DAT score to see if you can handle that. I think another thing, and this is always something I want to throw out there because I consider this, and I don't know that students always think about this when they're looking at the admissions process, but we're not just admitting students, like we're admitting future dentists. So you got to be professional. You've got to be able to show. I mean, there's a lot more than just academics you've got to show. There's a lot more than test scores that you have to show. We're really gonna be looking for a lot of other things in a person too. So sometimes I think they forget that.
No, I 100% agree. I think they quickly forget, oh, it's not just about the score. There's a lot of other moving parts and pieces and things you say. Well, the next question I have for you is letters of recommendation. And a lot of students stress about the letters of recommendation, a lot of it because it's out of their hands to a degree. But what kind of stock do you guys place in a letter of recommendation?
I think they're always reviewed. And I think that we probably do place a good amount of emphasis on those letters of recommendation because it also it's not just saying, hey, I'm really good at this class, or hey, I did really well, with my pre-health advising or with my shadowing or what have you. But I also think it shows us how students network. So like we don't want a letter of recommendation. This is going to be so bad. I'm saying it anyway. I don't care.
Yes, that.
From Dr. Fancy Pants, who's the fancy pants over chair dean. We don't want that, particularly if you don't know them, because what happens, you know this. I will read 3 paragraphs about Dr. Fancy Pants and everything that they've done ever in their life and how fantastic they are, and then I'll have a blurb at the bottom about the student was in a class, whatever the class was, there were this many students in there, and the student completed with a letter grade of whatever, and they strongly believe that this student would be an excellent fit for dental school. But I didn't hear anything about the student. And so good, strong letters of recommendation are from professors you've interacted with. It's showing us that you get involved in your education. It shows that you are very active in networking and because you're going to be working with people like dentistry, you work with people. I tell students all the time, I was like, we want you to shadow because we don't want you to get into dental school and be like, oh, I don't want to touch somebody's mouth because that's all you do. So I think that letters of recommendation, you can take them more with a grain of salt. Don't overstress them. Look at, some students have pre-dental or pre-health advisors and they do a committee letter, and that's wonderful. But when you're thinking about picking out your individual letters of recommendation, look at people who know you. Did you get to know that chemistry teacher really well? Even if you only got to know them really well because you were doing really bad, you needed help. They are people who can talk about your motivation, your abilities, those kind of things.
And in terms of, you had mentioned right before we talked about letters of, there's a lot of stock that needs to be played in just the applicant as a whole outside of the scores, personal statement and other essays in the application. How does a student better express who they are in those essays? That way you guys can get a better feel on who that student is, if that makes sense.
Yes, because a lot of times students will say, what can I do to make me stand out? And my very honest answer is, be you. You are what's going to make you stand apart. You are what's going to make you be, like when I'm reading all the personal statements or we're looking through all the applications, if we look at that and we can see who you are, you're standing out. So in like your personal statements, you want to talk about things that are unique about you, whether
Mhm.
that's your culture, whether that's the education that you've had, whether that's some really awesome experiences that you had. Those are the things we want to know about, because this is the one time that you can be super personal and tell us anything that you want to. There's no yes, no answers. There's no right or wrong answer. You can put it all in there. So I always tell students, make it as personal as possible. I don't want a regurgitation of your application. So
Yes.
I'm not wanting you to
Yes.
go, please don't. We've already read that. And when you do the ADSATS application, like I don't think students know that when it gets to us, it can be like 40 or 50 pages.
Yeah.
And so we're like, could you not just make me read all that again? Like make it personal. Tell us your why. Why dentistry? What, if there are some life experiences, I mean, obviously, yes, pull something from, your resume, pull something from the rest of the application if it was impactful. Just don't regurgitate the entire application. Is too much.
Yeah, and I think one thing that I see a lot and I'd love your opinion on this, because I think a lot of times students we see in these personal statements we can get away from the resume a little bit, and then they try to share an experience of like a limited experience they've had, and you in dentistry, for example, like they've only shadowed, and so they're trying to talk about this experience they had in dentistry, and it's like really kind of a weak experience, you know what I mean? And I'm
Yeah.
almost like, I'd rather have you not talk about that and talk about something you're passionate about and relate it to dentistry,
Yeah.
just because it's so frustrating, because like it's not authentic, and it's like this giant paragraph in the middle of your essay that I can feel a disconnect, you know what I
Yeah.
mean?
Oh, I
So
know
I don't know if
exactly.
you see that all the time as well, but
Yes, we do. And we see, kind of piggybacking off that, we see students talk about the specialty they want to go into. I'm just like, you got to get in dental school
you got to get
first.
into dental school first.
So don't tell us that. Like, don't tell us that. I mean, if you want to blurb it out at the bottom about this is a future goal, or you're excited to learn more about these programs, particularly pediatrics, because everyone wants to be a pediatric dentist till they get to dental school. Um, I mean, seriously. Or an orthodontist. But, tell us about something that happened in your life and how you can relate it to dentistry. Like, I agree with that 100%. I would much rather hear an authentic experience and your ability to show how you can, you know, how that would relate to dentistry in general, than a very simple, not really impact, because you know what? It probably wasn't the most impactful thing to them for dental school. It was some kind of experience that they had. And students have all kind of experiences. I mean, you read the ones where it's like very dramatic, like they had to have an entire facial reconstruction from a car
Yeah.
accident. And then we have some students who, maybe they had an experience with a family member who didn't have access to care. Um, or even you come from a family of dentists, which, can I just say real quick,
Yeah.
if you come from a family of dentists, do not chateau at your family's dental practice.
Amen to
Please.
that.
I mean, if you want to get a little bit, yes, but don't do all your shadowing there, because let's be real. If that is your grown-ups, dental are they really gonna, who's gonna say something bad about their kiddos? I mean, some people might.
Yeah, it's not really going to happen. And don't
It's
have
not.
them write your letter of recommendation, whatever you do. Like, are you, yeah,
Exactly. Or the students will tell me, they're like, oh, well, it's a big practice and there's multiple dentists in there. Do you think that your grown-ups, you know, practice partner is going to say something bad about you? Oh, are
no,
they just going to make you out to be this fantastically wonderful person? Like, I just don't think that those are the kinds of letters of recommendation that you want coming in. You want someone who can really speak to your experiences. So I always tell students, I mean, that is like my number one thing when I talk to students about shadowing. Is if they tell me that their family members are dentists, I'm like, don't shadow at your family. Don't shadow there.
yeah. In terms of interview,
Hmm.
Everyone always stresses about the interview, and every school is different the way they have it set up, whether it's a multiple mini interview, a two-on-one, good cop, bad cop kind of scenario, or a one-on-one. How does
Hmm.
UAB do it, and what are some of the key things that you guys are looking for in your rubric that you want to see out of an applicant? I know you don't do the interviews, but I know you know about it.
So our interview day is like a half a day kind of thing. So, where if they do it in person, if students come in person, we have lunch and we have our dean comes down and says hello to everybody. We do some tours. We have some student panels, a couple of presentations, that kind of thing. Actual interview itself is only like 20 minutes. And so we do a panel interview. So it would be the pre-dental student, and 2 to 3, sometimes 4 interviewers. And so one of the things that we're looking for in those interviews is maturity, interest. I mean, because you're dealing with people. Like, this is not, you have to be mature and be able to do the coursework. We're going to be looking for, true interest in dentistry. We're going to be looking for you being very personable, very interested in what you're doing, that kind of thing. We want students to be polished in their interview, but not rehearsed. However, any and all possible dental questions is available on Reddit. Just Google it. I mean, like, get on Reddit, look it all up, every question that could possibly be there. One thing I always tell students, though, is that you need to keep in mind that anything on your application,
It's fair
anything,
game.
is fair game. The good, the bad, the ugly. If you talk about it in your application, there's quite a big possibility it's going to be something that you're going to be asked about, particularly like in personal statements. Well, even in like extracurriculars. Let me give you a big example. We had an excellent student came through, like looked really great. Everything was good. We did his interview, and I remember after the interview came out, and he was like freaking out. He was like, "Miss Wendy, it went bad. It went bad. It went south." I was like, "How did it go bad? How did it go south?" And he was like, "All we did was talk about my hobbies." And I was like, "Okay, well, it's a 20-minute interview. Okay." And he was like, "That's all we did was talk about." I said, "Well, what is your hobby, friend?" And he was like, "I do spear fishing." I was like, "Spear fishing, like a spear fish ocean?" And he was like, "Yeah." And I was like, "Friend, we are in, central Alabama. There is no spear fishing happening here." I said, "I think that was probably something that, the interview committee got really excited about because it's new and it's different." And they're like, "Yeah, but that's all I talked about." And I was like, "But you talked about your passion. So we got to see how you communicate with people, how you express yourself. You really got to showcase things that are important to you and why they're important to you." So sometimes students will come out of an interview not thinking it went well when, I mean, that student was stellar. He got an offer, but you think it's just the answers to the questions that we're looking for. It's not. We're looking at who you are in those interviews. So, we do them in person or virtually, because a lot of times, like the way that we interview is we interview from August until the first week of December. And so some of that hits in with like holiday and break times and things like that. So we do still offer students that opportunity to, do virtual. Plus, we have students in our program from, New Jersey, Utah, California, Wyoming. I mean, they're everywhere. So may not be as easy to hop on a plane for everybody to come down for an interview. So we still do virtual as well. No preference, in which one students do. Or even if students are like study abroad or something like that, they can still do their stuff with us there. So, but like I said, no preference, in whether the Zoom or the in person is better. I just want students to be comfortable. I want students to come in and really just talk to us and tell us about them, and not be overly stressed about the questions you're going to be asked. I've had more students that not come back and say, "Wow, that was way more laid back than I expected." And I'm like, I mean, yeah, I mean, you proved everything. I mean, if we're interviewing you, we are interested. You have got the qualification. So it's you just kind of coming in and telling us, talking to us and saying, it's kind of like, do you like us? Do we like you?
Yeah, it's like
You
dating at that point. It's like, are we a good fit or are we not a good fit?
Yeah,
So,
do you like our school? Do you want to come to our school? That kind of thing. So, yeah, absolutely.
well, just kind of closing up here, do you have any final pieces of advice or things that you would want people to know about UAB
Mhm.
that you would feel are important to share?
I think a big thing, and this is not just for UAB, this is for all dental schools, is know that we get so many more applications than we have spots. I mean, our seats we have 84. I mean, so we're going to bring in 84 students every cycle. We may get 12 to 1,500 applications for those spots. So I tell students sometimes you don't get in, and it has nothing to do with that you were not the most awesome student ever, but that because we had 84 slots. And not to be afraid to say, okay, well, why didn't I get in this time? What do I need to do? Do I need to do a graduate program? Do I need to do, postbac? What do I need to do to be an even more competitive applicant the next cycle? So I was still, there's lots of reapplicants. I have students who may have to reapply 2 to 3 times to get into a dental program. So I think that that's a big important thing. I think another big important thing, particularly about UAB, is reach out to us. I mean, students can contact me. I can answer questions on email. Like I said, I'm willing to schedule appointments, individual appointments with students. Visit campus. If you have the opportunity to visit campus, come and visit us. We do tours every Friday. If you're interested, they can shoot me an email. All students can do this. Shoot me an email. I'll send you the link to register, just so we make sure we have enough people there to do the tour. And UAB is just a good place. I think our students have a very positive mentality. I mean, if you're looking to come in here to step on people's toes to get ahead so that you're the best of the best, this is not the right fit for you. We are a much more cohesive group where everybody is rooting for everybody. And I think that shows. The dean will know your name. I mean, he's not just wandering the halls staring off into the blue yonder. I mean, he's talking to you. He's saying hello to you. He knows your name. He has open office hours, one day every week. That's just literally anybody come in there. You can always schedule appointments with them. So I think you need to get to know your dental school and make sure that that's going to be the right fit for you. And I hope it's UAB.
Well, that is wonderful. It's been a pleasure to talk to you, Wendy, and to learn more about UAB and to hear the wonderful things you guys have going down there in Birmingham. So that's great.
Absolutely. I
Well,
appreciate you letting me be here.
well, thank you for coming on once again. So that is it for today's episode of the Dental School Guide podcast. We will catch you guys in the next episode. And if you guys ever have questions, I'm sure Wendy would love it if you guys reached out to her. Feel free to reach out to her. We can have her email in the show notes if you would like to reach out to her. So thank you once again. Have a great one. That's all for today's episode of the Dental School Guide podcast. We hope you've gained valuable insights and inspiration to fuel your journey into dentistry. Don't forget to subscribe to our podcast for more expert advice, inside tips, and engaging discussions. If you enjoyed today's episode, please leave us a review. It would mean the world to us. Until next time, keep smiling, keep striving, and remember, your dental dreams are closer than you think. Thanks for tuning in to the Dental School Guide podcast.